This is Dr. Jennifer Jansen from the Zeph Center. You're listening to JJ's Clinical Connection, connecting you to clinical topics. Welcome back to JJ's Clinical Connections. July is B.B. Moore Campbell National Minority Mental Health Awareness Month, and today we're having a heartfelt, honest conversation about the impact of generational trauma, cultural norms around mental health, and how a new generation is beginning to break these cycles. For this conversation, we're joined by Director of Youth Services, LeFevre, and Manager of Youth Therapy, Amy Eastwood. These outstanding clinicians bring their own experiences, cultural insights, and professional knowledge to this powerful discussion as we explore how trauma shows up across generations and what it looks like when families begin to heal. We'll also take a closer look at how children may express trauma differently and the importance of supporting both parents and kids on their mental health journey. Whether you're a clinician, a caregiver, or someone navigating your own family history, this episode is full of insight, hope, and inspiration. Stay tuned. I'd like to welcome Leslie and Amy to the studio today. Would you guys like to introduce yourselves to our listeners?
My name is LeFevre, and I'm the Clinical Director of Youth Services at Zeph Center. So I oversee therapy, day treatment, and case management services in our youth programs, and I've been at Zeph for 9 years.
My name's Amy Eastwood. I am the Clinical Manager of Youth Therapy Services, so I oversee our therapist at Woodruff for our youth services, and I've also been with Zeph for 9 years.
Well, great. Tell us about your role here at Zeph and your experiences with our youth therapy team.
So I started off as, both of us started off as line staff when we first came to Zeph Center. So we were both office-based therapists before we moved into supervising the therapy team, starting with students. And then we also moved into management positions and now started overseeing some of the therapists and work towards their clinical supervision hours. So I've had extensive experience working with the youth population, primarily the early childhood.
I've had similar experiences with Leslie in working with the youth population. I also started off as an office-based therapist at the Zeph Center. I moved into team lead several years after that, and most recently moved into management. Prior to my experiences at Zeph Center, I was also providing youth-based services for the community.
Great. Well, this month we're talking about youth services with a special focus on minority mental health. I'd like to start off with asking you about why minority mental health is an important focus for the work that you guys are doing.
I think in regards to minority mental health, just making sure that all members of our community for the youth that we provide have access to all the services they need to be happy, healthy, and to help support their families, be able to support their children.
And I feel like over the years, so both of us have been in the community mental health setting for several years at this point. There tend to be a lot of minority demographics represented in community mental health clientele. So it's important to recognize the need for different minority groups to receive mental health services because there is certain stigma attached depending on the cultural background of different families. It might not be the norm to seek help or recognize feelings in general and kind of shove trauma down versus addressing it up front. And so I feel like the stigma attached to getting help when you need it is important to recognize that it exists and then help them overcome that barrier to get the help that they need.
And I think just with our treatment of youth, just making sure we're using evidence-based treatment that's proven to be across the board beneficial for all groups of people, and just making sure they get the support they need.
In many cultures, past generations didn't talk about mental health. Why do you think that was, and what are some of the consequences of that?
I feel like a lot of it is related to there's more awareness now. Social media has really blown up the mental health field as far as bringing about awareness, and people are more vocal about mental health struggles. And I feel like it's made people be able to feel like they can be more open, whereas in the past there was less psychoeducation, less awareness, and I feel like people tended to either suffer or struggle behind closed doors and didn't feel as comfortable coming forth since they didn't see as many people that were having those open discussions. I feel like in the past, a lot of those conversations were not happening, whereas now they are happening more often, and it's making people feel more comfortable seeking help.
And that's really part of our trauma-informed care model too, right? That we are creating safe places so that people feel they can access the services that we have to offer.
And I think some of the youth that we serve, especially some of our teenagers, they're understanding that maybe the ways that they see family members operate and solve problems isn't very healthy. And so they come to services because they want to learn different ways and I guess be more effective in how they handle life's problems. And we can help support them with that.
How does the generational trauma show up for these families in the communities that we serve?
I feel like the biggest area that it's magnified with the population we work with is when we see the grandparents, or I've even had great grandparents raising great grandkids. And so when they're coming for help, a lot of times those family patterns have already been established and they're continuing those patterns because they are doing the best with what they know. That's what they know, so they're going to continue to do it. I've had grandparents in my office say, like, this is how we've always done it, or like, we used to be able to do this when I was younger, is a common comment, or my parents, we did this and now I'm fine. And so having those conversations with them to help them realize like that it's okay to not be okay and to be able to get the help to break those patterns.
I think a lot of grandparents recognize, like, if we would have taken steps when my daughter was little or when they were a young adult, maybe I wouldn't be here raising my grandkid. We could have gotten the supports that we needed. It's hard. Most of these grandparents, this is not what they expected to be doing this stage in their life, but they are because they want to be a support for the family. But I do think there is some eye-opening experiences with, oh man, if my kid were here when they were 8 years old, instead of me having to bring my grandchild here when they're 8 years old, I wonder if things maybe would have been different.
One of the things that Amy and I often talk about when we would do parent groups together is that we honestly do feel like the majority of the parents we work with are doing the best with what they know and doing the best with what they grew up with, doing the best with what they were taught. And so we always try to emphasize that with the parents we do work with, just meeting them where they are with the understanding that it's coming from somewhere and not just them wanting to be a bad parent or them wanting to negatively influence their kids. And so I feel like really approaching them with the understanding that they learned this somewhere, and a lot of the parents either are going to learn new skills to break those patterns or continue the pattern. And so our role is to kind of help facilitate them understanding and recognizing that it's unhealthy patterns that need to be broken.
Can you share a moment in your work where you saw the impact of cultural norms on how a family either addressed or maybe didn't address mental health?
I feel like I have seen it a lot with, especially kids tend to show their trauma in different ways, such as through their behavior. And oftentimes parents tend to think that it would be a quick fix to get put on like medication or get them diagnosed with ADHD or some sort of more behavioral disorder versus recognizing that trauma exists, or that or admitting that they may have exposed their children to something traumatic that would have lasting impacts. And so I feel like that really influences the work we do.
Well, kids really communicate through their behaviors, right? They don't have the same language skills that we have at this point in our adult lives. Tell me a little bit about what you see. What kinds of ways are the kids expressing their thoughts and feelings to you?
In young children, we tend to see kids have an increase in what appears on the outside to be anger or anxiety, when really it's trauma related. And so it's important being trauma informed and recognizing those symptoms so we can treat kids for the appropriate thing rather than just assuming what we see is what is happening.
I know I've worked with many cases where they get referrals from school or someone outside of the family for behavioral treatment, such as behavior therapy, or wanting them to get put on medication. And then when they come in for an evaluation and we further explore those symptoms, it ends up being a trauma diagnosis instead of ADHD or something like that.
Research shows that trauma literally rewires brain chemistry. Those early childhood years, specifically birth to 3, are so important for that brain development. So when kids are in a constant state of fight or flight, we're in constant states of stress, their brain is what is like literally wiring to those things in their environment. So we're going to see kids who maybe are scared a lot, or like they feel unsafe, and it's their brain misfiring. Like these are completely safe situations, but because of experiences, their brain is wired to believe that I am not safe and I need to escape, I need to freeze, whatever the case may be. And so I think, although typically we don't see kids until those first few years, just their brains are still developing. And so if we can work on repairing some of those experiences within the family unit, so hopefully we can have a better outcome and maybe rewire some of those connections along the way.
How can silence around mental health in one generation affect parenting or relationships in the next?
I think it's important to have open conversations with kids so they know what is okay to talk about. When kids bring up difficult conversations, and parents naturally will get emotional because they care about their kids when something bad's going on, but kids view that as, I'm making my parent upset, I don't want to talk about that anymore. And so they shut down. And so I think when people come in accessing services for their youth patients, we do the social determinants of health. We do the adverse childhood experiences survey so we can work with the families to recognize maybe areas to work on. And so they know like it's okay to talk about these things. We talk about how culture impacts their schooling, their home life, their peer relationships at the time of intake. And I think just having those conversations right up front gives an open door so these families know it's okay to talk about these things because we kind of open the door to let that happen.
Are you seeing a shift in younger generations, maybe being more open to therapy and healing and self-awareness?
I feel like we have kids younger and younger who are telling their parents they want to get therapy services, so it's not the parents thinking, I need to get help for my kid. The kids are coming in and they're realizing that they don't want this to be their life and they want to make things better for themselves.
What do you think's driving that change?
Leslie mentioned earlier about social media. Social media does have its positive points where kids will come in and say, hey, like I heard about this diagnosis. What are your thoughts and how that might relate to me? And so I think there's just added exposure and that makes it more comfortable of a talking point.
What are some barriers that still exist, especially with minority populations, when it comes to accessing mental health support?
I know a lot of the families that we work with have maybe lack of support. So you might have a single mom or a single dad who's trying to work multiple jobs, and it's hard to get their kids to appointments and be able to follow up on medication management, case management, therapy. And so I think making sure, again, at that time of intake, we identify all the resources that would be helpful so we can help their kid get these services if they have needs that need to be taken care of before.
I feel like one of the barriers for the population we work with, especially the minority groups, is just accessing those services, knowing how to do it, navigating the system, the lack of funding if that gets cut, and just having the ability to access the service when they are ready. Because the one thing that we've noticed is that when they are finally ready, if they have to wait for an appointment, then they tend to either not want to by the time the appointment comes up, or change their mind, or maybe go somewhere else. And so that's one of the barriers that we've been trying to work on, is increasing the ability to access those services more quickly.
And a lot of our families, not just necessarily clients in certain minority groups, but kids as a whole, there's a lot of invisible barriers that we don't see when they come into the door. And so I think just understanding that there's a lot of things that happen before they get into your office. There's a lot of needs that they have that might not be necessarily what you plan for that day, but just making sure that we can provide the support that they need. We want our kids to be safe and happy and healthy.
One of the most difficult parts right now with the population we're working with is many of them live in these communities where, if you've turned on the news lately in Toledo, there's been many shootings and deaths in our communities. And so when we are trying to work with our families on getting a better environment to work through their trauma and to work through these mental health symptoms. It's really hard when they're feeling stuck in these communities and see the violence increasing, and they want to do better for their family. They want to do better for their kids. But due to whether it's financial reasons or lack of those resources in the community, it's really hard for them to break through that and to get out of the community that may be exacerbating the symptoms.
And when we were talking about things to notice within your child, we were talking about some of those behavioral symptoms, but also some of those like peer relationships. And I feel a lot of our families and a lot of our kids don't have like the adequate supports that they need. And kids will find those supports some way, shape, or form. And unfortunately, sometimes that's not with the most healthy peer group. I know when we see news stories most recently, and we're hearing 13, 14, 17-year-olds are victims and perpetrators of crime, I think everyone's first reaction is that one of our clients? Is this impacting like the kids that we work with? And I think just making sure that we can provide those supports early on to hopefully so children aren't having to try to find those supports on their own.
What are some early warning signs that a child might be struggling with trauma or affected by a parent's mental health challenges?
Like we mentioned before, kids tend to show it through behavior. So you might see, I feel like the majority of the time when we get referrals, it's the schools. Daycares, schools are on the verge of kicking them out, and this is the final straw. You need to go get a mental health evaluation or they can't come back. And so I feel like that's a lot of times when we get these referrals is they're on the brink of getting kicked out of school or removed from a daycare placement because their behavior is so severe. So you might see aggressive behavior or disrespectful behavior towards staff, non-compliance. And so it all comes out in their behavior and acting out. Maybe they were acting out one of the traumatic events that they witnessed or something they've seen at home or in their environment. And so it tends to come out in those kind of ways.
We also notice changes into sleep hygiene, decrease or increase in appetite, maybe a change in friend groups. Maybe they're no longer communicating with the friends that parents frequently heard the names of.
You've mentioned several things that we can be on the lookout for in terms of children's behaviors. Is there any other ways that trauma shows up differently in children compared to adults?
I feel like the tricky part with PTSD especially is one of the diagnostic criteria when you're working with adults is the flashbacks or the re-experiencing type of symptoms that you typically associate with PTSD. And with kids, it's so hard for them to vocalize those things, especially the younger they are, because we see as young as 2 at Zeph. And so I feel like that's the biggest piece that's difficult with diagnosing kids is their ability to be able to vocalize. Whereas you can see the behavior in front of you acting out. You can see them not eating as much. You can see their sleep patterns disrupted. But it's really hard to get them to vocalize their thoughts and what's happening internally just because they're so concrete in their thinking and it's really hard to vocalize.
And that's why it's so important to have that trauma-informed outlook in treatment and having competent clinicians so we know the symptoms that are being presented may appear to be defiance, they may appear to be depressive, they may appear to be ADHD, but recognizing that those symptoms are also symptoms of PTSD and trauma-related disorders in children.
And you mentioned working with very young children, obviously through adolescence. Tell us what you know about brain development and how trauma impacts even the youngest children at a neurological level.
There is more and more research happening that even in utero, when a mom is pregnant, there are changes to the brain as the baby is developing, whether she was exposed to a traumatic event or there was domestic violence happening in the home. So there is more and more research regarding brain development as far as brain size being smaller, or maybe the neural connections are not as strong. And so we are seeing more and more of that research happening. I just feel like there still needs to be more research and more advocacy in that area.
And I think recognizing as well young children who experience traumatic events, even if they didn't exactly witness it, but they're continuously around the event. Still, the stress levels of those kids, they still pick up on those. So even if they weren't present for an event, but they were in the home at the time, that still impacts their development, impacts their attachment to feeling safe with caregivers and other adults in their life.
How can providers and caregivers then better support children who are navigating complex emotional experiences?
I feel like the first step is always going to be being supportive and being there to listen. A huge part of our treatment in any evidence-based treatment for trauma is psychoeducation for the parent, not just the child. And oftentimes those psychoeducation sessions happen separately because, like Amy said earlier, the parent might not be able to control their response to the information. And so you don't want to have the child be put in a situation where they're feeling uncomfortable or like they upset the parent. And so it is important to kind of have those conversations, because it's amazing to me how many times in my office that even when we go over adverse experiences, how people may not even realize it was a traumatic event that they went through until they see it on paper. And they're like, oh, that was probably not a good thing I witnessed.
I think too, we work with a lot of kids in the foster care system. And so going back to some of the culture and some of the lack of addressing those mental health symptoms, sometimes kids don't come in our care until they're placed in the foster care system. And then we can start working with the kid who probably should have received services a long time ago, but the children don't have access. They rely on the adults to connect them to those resources. But I think it is nice being able to, if they get placed in the foster system, eventually reunification, more than likely maybe a goal with the parents. And then we can work with the families while there's still time, while their kids are still young, and we can hopefully kind of build some of those bridges and connect those services, even if it would have been better if it were a while ago, but it's better late than never. And we can hopefully provide a better future for those kids and their families.
Absolutely. And it really is part of the work that you do is family systems work. It isn't just therapeutic services for a child. It's therapeutic services for the whole family unit. What does healing from generational trauma look like then? And is it ever finished?
I feel like the biggest part when you're working as a family system is each person working on their own stuff before we start bringing it together and working on it as a whole family. And we often talk about how sometimes we feel like we're planting all the seeds with the kid, but if no work is being done in the home to change the environment, it's like none of those skills stick. And it's really hard to heal generational trauma.
In regards to if it's ever finished, I don't know if healing is ever finished for anybody. I think we are all constantly growing, learning new information, taking that knowledge and applying it. So I think for everybody, like healing and learning never really finishes. We just continue it. And
I feel like one of the steps is like at least the family is acknowledging it and there's more awareness around it. Even if they are having discussions about it that are ongoing, at least they can be hopefully healthier conversations as they're continuing to heal. But it definitely might be an ongoing process as they're working through it and hopefully preventing future generations from having the same problems.
What role can culture, community, or tradition play in that healing process?
I feel like one of the biggest pieces is when, if it is not culturally acceptable to seek mental health help or to even acknowledge that difficulties with mental health are happening. Unfortunately, there is still a stigma attached to mental health services. And it's much easier to say I need to go get heart surgery versus I need to go get trauma treatment. And even, some people might, as they're getting older, even feel like their parents might feel some type of way if they know you're going through trauma treatment and just acknowledging that something happened. And so I feel like that's the biggest barrier is just the stigma attached to just getting mental health help and acknowledging that a diagnosis may exist.
And creating a safe space is truly the core of our trauma-informed care model. How can we create safe, inclusive spaces for families to explore mental health without shame or judgment?
I feel like it just starts with that first either the first appointment or even that first phone call. I think it's great that even people who are non-clinical are trained in sanctuary at Zeph so that they can enter every conversation with that trauma lens, because it does truly start with that first conversation to make them feel comfortable. Because if someone answers that phone that is not willing to hear them or just listen, some of our families just want someone that will listen to them and believe their story. I feel like it just starts up front like that. So we've talked about like even our walk-in psych urgent care at our Woodruff location. We've talked to those staff about how this is their first step to getting help. And so being a welcome presence and listening to them. And we have had the experience where people will be like, well, you're this white girl. What are you going to tell me about mental health and what my struggles are? And you're right. Like, I'm not a minority, but I can acknowledge that and I will be the best advocate for you. And I can still support you through those struggles.
And I think at the time of intake or maybe their first appointments when they're developing their treatment plan, just making sure that we're listening to them on what they feel is beneficial and what they need from us, making sure we're not coming in and looking at the situation and identifying goals that we think would be helpful. That's not why they're here. They're here so we can help them, and we have to listen to how we can help them. Kids come into services and they tell us, I feel like I was targeted because of the color of my skin or because of my sexuality. And being able to have those conversations with the families and be able to connect with the schools, maybe include a school counselor, maybe include a caseworker, their Ohio Rise worker, so we can sit down with the school and say, hey, this is an identified concern that this child has. How can we work through this so we have a successful school career, so they feel safe going to school? So we're not seeing maybe some of those negative behaviors because they don't feel safe, they don't feel wanted in those settings.
What advice would you give to someone who's the first in their family to break the silence around mental health?
I think acknowledging the bravery of being the first in your family to take a step in doing something like that. I also think maybe being, kind of talking about negative consequences that could arise from that and how we can still be a support to you, even if things change in your family system because you've chosen to take this step.
And oftentimes, even if no one in their family has acknowledged the need to get mental health help, there may be at least one person in their life that is willing to support them in this decision or has helped bring them to the decision that they need to get help. And so I feel like that is truly where that makes the difference, when you have at least one person who can support you in this journey.
Do you have any final thoughts you'd like to leave with our listeners today around generational trauma, minority mental health, working with kids and adolescents?
I feel like one thing that is important for caregivers to understand is that when they bring their children for services, we are not here to judge their parenting. We are not here to judge anything that has happened in the past. We're here to meet them where they are today and help them come up with a plan to move forward. Because we often have parents that come and are nervous about, like, you're going to tell me I'm a bad mom or you're going to try to take my kids away. And that's not our goal. Our goal is to help you be the best parent that you can. I often acknowledge, Amy and I both say in our parent group, like, I still struggle. You should see me as a mom at the grocery store. It's not pretty. And so I feel like parents need to understand that and see that humanness, that it's okay that your child needs help. It doesn't mean you did anything wrong. And let's help you take steps to move forward with your child in the best way possible.
I think some of it goes back to the shifting that focus on what's wrong with you to what happened to you. So being able to, like I said, collect all the data that the families provide us at the time of intake and providing like a good path of treatment, like what our recommendation is. And again, like Leslie said, we're not here to judge you. You came to us for help. We are honored to be able to help you. And like, it's a great feeling that families can trust you with everything they have to share with you. And I think that's really valuable. And we need to keep that in mind when treating families, that they're coming to us for help. And it's a great feeling to be able to provide that safe space and that they're getting the help they need.
So if our listeners are hearing this conversation today and they're thinking about, gee, maybe I want to get my kid into services, maybe I could use some help with our family system, what are the first steps that they might take?
So right now, the new patient appointments at Zeph Center for our youth department are handled by the youth therapy team. So the parent just needs to call the main Zeph number, and they just need to let them know that they need to schedule a new patient appointment, and they will be linked with our intake schedulers. So all of our therapists have 2 new patient appointments built into their schedules each week that they will be offered one of those first appointments. They'll fill out the paperwork that's sent to you online and then come to that first appointment, and the therapist will take it from there.
We have a lot of families who access multiple Zeph services. Even sometimes they come in because they were already a Zeph patient, so they brought their kid here to stay within like the Zeph community. But there are times where parents recognize like maybe I do need help, because through talking with the family about the environment that they're exposed to, their child is exposed to, I think parents do sometimes realize like this is not a healthy situation. And sometimes people just don't know what they need to, that you can recognize it's unhealthy, but taking the next step is hard. And so we have had parents who utilize like our adult therapy services, and case management services, so they can get the supports that they need to better help support the child that they initially brought into services.
Leslie and Amy, thank you so much for coming in today and sharing all this really important information with us. That's all for us today. Thank you for being part of this vital conversation. As we observe Minority Mental Health Month, let's remember that healing is not just individual, it's generational. While past generations may have been taught to stay silent, we now have the opportunity to speak up, seek help, and support each other through that process. If this episode resonated with you or reminded you of someone you care about, don't hesitate to reach out to our trauma-informed team. You're not alone, and healing is possible. If you enjoyed this conversation, be sure to download and share this episode. For the latest clinical connections, subscribe to Spotify, Apple Podcasts, or wherever your favorite podcasts are found. For more information about Zeph Center's trauma-informed mental health services and other resources mentioned in this episode, check out our show notes. For more information on Zeph Center, visit us at zephcenter.org or find us on Facebook, Instagram, and LinkedIn. Until next time, take care of yourself and those around you. This is Dr. Jennifer Jansen signing off.